Welcome to AFMC TV. I'm Robin Lippert.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Lippert. Thank you for joining us. Today I have with me Peggy Kelly, and she is the CEO of Youth Home Incorporated in Central Arkansas. Peggy, thank you so much for being here.
Thank you. Appreciate it.
So for members of the healthcare community who may not be familiar with Youth Home, can you briefly tell us a little bit about the mission and the population that you serve?
Absolutely. Very proud to say that we have been in existence here in Central Arkansas for 60 years. It was founded in 1966 by a young social worker by the name of Carol Smaley, who really had a heart for children in foster care. And so she wanted to start a group home for girls in Little Rock. And quickly she raised $60,000 to be able to do that. She quickly found out that those girls needed a lot more than just a roof over their head, that they needed a lot of good therapy. They needed medical care, education, life skills. And so that kind of morphed into what Youth Home is today. Currently, we have a PRTF, Psychiatric Residential Treatment Facility, out on Colonel Glenn Road in Little Rock. We have 54 active beds for children ages 12 to 17 that have a primary mental health diagnosis. Those children are either from Arkansas and have Arkansas Medicaid, or they are TRICARE recipients. So they are children of military families, either active duty or retired. And they come from all over the country, all over the world, to get services here. We specialize in attachment work and reactive attachment disorder, but we take, of course, kids with any prominent mental health condition. Also out on Colonel Glenn, we have a QRTP, Qualified Residential Treatment Program. And that's from kids 11 to 17, boys and girls who are currently in the foster care system and also have a mental health diagnosis that really needs treatment, and they really aren't able to live in a family setting yet. So we treat those two populations, and then we have a small outpatient office in the center of Little Rock as well.
And trauma-informed care is a term that we hear often. And from your perspective, what does it truly mean in practice, not just in theory?
Thank you for that, because I get frustrated. A lot of times, many agencies or many organizations will say that, they're trauma-informed. And that can mean anything from our therapist read a book about it, or we went to a 3-hour CEU to help us get that education. But trauma-informed care is a true culture change for an organization. In 2018, Youth Home decided to make that change, and we implemented a program and trained every single person in our organization, from our receptionists to our kitchen team to our maintenance staff, in 32 hours of trauma-informed care training. And what that means is we treat children that have experienced significant trauma. The worst thing that we can do is re-traumatize them while they're in our care.
And how does childhood trauma show up in medical or behavioral health settings?
In a multitude of ways. Trauma, it's oftentimes very difficult to understand a child's triggers. For example, if they have experienced significant neglect and food insecurity, they may escalate at meal times, and you don't understand what exactly is setting them off. We've got children that, of course, have experienced sexual abuse trauma, and they're going to respond maybe to the the demographic of their abuser. So it's really being very in tuned in that relationship so that we can notice when these behaviors begin to really ramp up and how to connect with them. It's all about connection to help them learn how to de-escalate and learn how to self-regulate.
What are some common misconceptions healthcare providers have about trauma and youth behavior?
I think they focus so much on the symptoms rather than the core reality of what's going on. And that's something we had to learn. Oftentimes in the beginning, when our cottages would experience a kid whose behavior was just so unpredictable and so challenging for them, oftentimes what I would recommend is that get the chart out when you have some free time. Please read their history. And there's so many clues if we've got a good history as to why they're responding the way they are. And so having that big picture focus is so critical.
And how can unrecognized trauma affect long-term physical health outcomes?
Oh, it's there's been a multitude of studies, and I wish I could quote statistics for you, but absolutely, we know from the ACEs study, Adverse Childhood Experience study that was done years ago, that it absolutely plays a huge part in chronic conditions, in diabetes, in cardiovascular health, mental health. It shows up in a multitude of ways. And if we can help children at this age learn to manage and self-regulate, we can avoid some of those consequences. I'm committed to that. And I get frustrated sometimes with public policy because we're not taking advantage of the window of opportunity that we have to help these kids.
And it is critical for primary care and physicians and pediatric practices to adopt a trauma-informed lens.
Absolutely. You have to ask the difficult questions. And I'm so glad to see that there's a movement towards integrated health where a lot of big hospital systems are integrating behavioral health professionals and offices into their practice. We need to work together, absolutely. But a primary care physician oftentimes has such a limited amount of time, and they don't know what to ask, or they're very uncomfortable asking the difficult questions. That's something that I think needs to be taught and needs to be supported by behavioral health professionals.
What training or even a mindset shift are necessary for staff to consistently practice trauma-informed care?
Again, I think it's the shift from what's wrong with you to what's happened to you. It's we have a motto at Youth Home: we don't correct until we connect. That's hard. If you see a behavior that's somewhat dangerous or unanticipated, oftentimes the way you were raised encourages you to correct that behavior immediately. And a child who's experienced significant trauma is going to react to that abrasive, correction tactic. We encourage our staff to build that relationship with that child first before they try to help them learn that their behaviors are unhealthy or dangerous.
Now, how do you partner with healthcare providers, hospitals, even community organizations to ensure continuity of care?
Oh, that is a challenge. We oftentimes, because Youth Home does not have an acute wing, we don't do acute care. We partner with our various acute care partners in hospitals, Children's Hospital, Pinnacle Point, Ridgeway, Rivendell, Methodist, to when our children have really become a danger to themselves or others, an immediate danger, and we can't keep them safe on our campus, we have to then have them go spend a few days in an acute facility. And we have to really have an understanding of how that facility is going to treat the child. And if we're not communicating if our therapist is not communicating with the therapist in acute, if they're not giving them hints as to what is working for us here or what is setting them off and what their triggers are, then we're not really doing the child any favors at all. So I think it's very important. And unfortunately, I will admit that we're all so stretched and underfunded that it's not always a priority, but it needs to be. We have really made a focus over the last 2 years to always communicate when we have to send our child to a different facility with that therapist.
And embedding trauma-informed principles into organizational culture is important.
So important. And let me say this. If it doesn't come from the top down, it doesn't work. It really doesn't work. If I am punitive with my staff when they have made a mistake or just practiced unprofessionally in some way, they're not able to understand and really embrace that trauma-informed connection with the child. So I have to form a connection with my team, and I have to know that another principle we try to remember always, everyone's doing the very best they can in the moment. And that's true for staff as well. It's certainly true for me. There are days that my best is not real good. And I have to give my staff that benefit. So one thing that we're doing at Youth Home, when we have to put our hands on a child to do some kind of physical restraint to keep them from harming themselves or someone else, we get that staff, their manager, and someone from our executive team, myself or our COO or chief clinical officer, and we watch that video together. And not to point out punitive mistakes, but to really talk to the staff about how did that feel? How do you think that child felt when you had to do that? What is their body language telling you? Do you feel like you were at your best in that moment? And if not, what could you have done to prepare yourself better? Just some real good coaching and support for those staff that have to do the difficult jobs that, I don't have to do day to day. If we don't give them the support and help them look through that lens of trauma-informed care, we won't be successful. And a lot of organizations pay a lot of money to get trained and buy these great programs. But if their executive team isn't committed to it, it's a waste of time and money and effort.
Well, before we go, Peggy, tell us what gaps still exist in Arkansas when it comes to supporting youth with complex trauma.
A lot of funding gaps. It costs us almost twice as much than the Medicaid reimbursement to adequately treat a child in our facility. So we have to depend on grants and fundraising and our reserves. And quite frankly, it is a challenge.
How can someone find out more about the youth home and the work, whether it's to get involved as an advocate, more from the healthcare, even community perspective? Where should they go?
Absolutely. We'd love for you to visit our website. It's www.youthhome.org. We welcome folks to come out and take a tour. We often say, if you come out to our beautiful campus out here, which looks nothing like a hospital, it looks like summer camp. We have little cottages. It's in a beautiful outdoor setting. We've got lots of things blooming out here right now. Usually when any group, a volunteer group, a family thinking about sending their child to us, come out here and take a tour, we've got them hooked. You can see what we value when you come out here. So we welcome tours. And then we have a big event coming up. It's our 60th anniversary on May 2nd. And we're having a speakeasy event, and all that information's on our website. So we'd love for folks to attend that. We're going to make it an event where you actually come away learning something about the mental health challenges.
Well, Peggy, thank you so much for taking the time to talk about your important work. And I appreciate all that you do for the youth of Arkansas. Thank you so much.
Thank you, Robin. I appreciate you.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.